Dr. Murray, what are the biggest problems with what the drug companies and the doctors won't tell us, and what are the things that we might be able to do to look for some sort of change in those areas?
Well, I mean, in my book, I look at every major class of drug, and I share with people the true efficacy, the rationale of the drug, and then offer alternatives. If we look at some of the more common illnesses that people are faced with, we can really see how irrational the drug approach is. Probably the biggest and best example of this is looking at the way drugs work in the treatment of osteoarthritis, the most common form of arthritis. Most often people are placed on non-steroidal anti-inflammatory drugs, and these drugs work to reduce pain and inflammation by blocking enzymes that produce painful and inflammatory compounds. In addition to inhibiting those enzymes, they also inhibit enzymes that build cartilage. So what happens is that people take the drugs and they actually promote the progression of the disease process. And that may be one reason why over 400,000 joint replacements are required each year in the United States. A more rational approach is to give the body the tools it needs to heal. And if we give the body the right support, things like glucosamine sulfate and MSM and these other natural agents that the body can utilize to build cartilage and repair the joints, that just makes a lot more sense. And that's the type of information I have in the book. If you watch the commercials on TV, you'd think that, boy, if you didn't have, if you wouldn't be able to sleep without a Lunesta. Boy, if you have arthritis because you're deficient in Advil or Motrin. It's not like that. But you can develop conditions if you don't give your body the right sort of nutritional and natural support, and that's what I point out in the book.
As an aside, I think one of the most maddening things, as far as I'm concerned, is that when you watch those commercials on television, they give you the impression that that person is an actual patient or is going through all that, and they're actors reading lines. I mean, and this is very important in saving lives, are actors reading lines.
Yeah, it's amazing. The drug companies are very smart with how they go out with their consumer advertising. Prior to 1997, it was illegal for drug companies to market their drugs directly to consumers. Since that time, if you turn on the TV, radio, read a newspaper or a magazine, you're going to see lots of advertisements for drugs. And they're very smart at how they appeal to the audience that they're going after. I mean, one of the commercials that really gets me is, Sally Fields. I mean, my gosh, she was a flying nun, for goodness sake. So you're certainly going to believe what she tells you, but what she's telling you isn't necessarily the best approach for building healthy bones.
I agree, and she's on all the talk shows now going through that as well.
Yeah.
Well, thank you.
My pleasure. Thank you.